So, did you have times when you don't have the urge to sleep, but because you have so much energy? For some, you may think about what I'm talking about, but for others, you may get the idea. Today, this video is about bipolar disorder, but this video will mainly associate itself with the three manias. But firstly, bipolar is a mood disorder, which can affect the brain chemistry when associated with mood, though its severity is different for everyone, since bipolar can actually have a time of low mood and times of high mood. This can actually interfere with relationships, activities, and day-to-day functions. Now, with three manias, acute mania, hypomania, and delirious mania, how do we define them? Well, they can be defined through how the bipolar affects the highs and lows of the individual. As well, diagnosis of bipolar 1 and 2, which can indicate the severity of the individual's episodes. So let's start off with hypomania. So hypomania can represent the friend of a person which are rapid, usually cheerful, and needs little sleep. But let's start thinking. Well, rather considering the fact that hypomania is a milder form of mania, when diagnosing hypomania, it can be difficult to diagnose because it may be a mere masquerade of happiness. But also observation in how they act and how they get distracted can indicate if they have hypomania. Next is acute mania. It's like hypomania but without its treatment. It becomes acute mania. Like hypomania, acute mania involves the lack of sleep and inability to drink, eat, or even have an appetite. Though from the high amounts of activity, acute mania develops after a few days. Those with heart issues are at risk of heart attack by acute mania. Though looking through their optimism and other factors such as no appetite, sleep, can mean that they have acute mania, or if it's in the developing phase. Lastly, delirious mania. So delirious mania is mainly the confusion and under-recognized neuropsychiatric syndrome. This usually involves delirium, mania, and psychosis. Although believed to be rare, delirious mania can compose up to 15% of acute mania cases. Though if improperly treated and left unrecognized, it can become life-threatening. Treatment for this involves a high dose of lorazepam, which is a drug used to treat anxiety disorder.
This is Jaiden Chicote. Thanks for watching.